Good morning. I am Dr. Nima Aghaebrahim, and I am a stroke neurologist and a neuroendovascular surgeon. In the previous talk, I talked about introduction to stroke. So what is a stroke? And we talked about ischemic stroke, hemorrhagic stroke, and what happens when part of the brain function gets disrupted due to a blood vessel that leads to weakness or numbness on one side of the body or inability to speak, and that's all called stroke. And a stroke is an emergency. In this talk, I'm going to talk about what can be done to prevent a stroke from happening. In order to know that, we need to know what are the risk factors or what causes stroke. Causes of strokes are different. There's some cause of stroke that we cannot modify. For example, there's some genetic disposition to stroke. There's age associated with stroke. But those are the things that we cannot modify. We need to know, but we cannot modify. So the focus should be on things that we can modify, so that way we don't have stroke, which is very similar causes to heart attack and other things. So for example, high blood pressure can lead to stroke. Chronic high blood pressure can harden the blood vessels in the brain, and they can block the blood vessel or they can burst the blood vessel, and that can cause a stroke or heart attack. High blood pressure overall is any systolic blood pressure, or that upper number, of more than 135 or traditionally more than 140. So normal blood pressure is around 120/80. So if you have a high blood pressure, you need to talk to your doctor and know what can be done to decrease or normalize the blood pressure. High cholesterol is another main problem that can lead to cardiovascular risks, stroke and heart attack. Cholesterol has different parts, and it's important to know the different parts of cholesterol. There's good cholesterol, there's bad cholesterol. So when you get a cholesterol number, that typically gives you a total number. It's important to break it apart. So you need to know the bad cholesterol. LDL and triglyceride are the two parts that are bad. And if those two are elevated, that can cause blockage in a blood vessel, for example. HDL is a good cholesterol, and the HDL needs to be high. That's the way blood clears up those bad fatty particles. Things that can help with the cholesterol are mostly diet and exercise. Diet means eating healthy, more vegetable, fruits, and less fatty and fried food. Exercise, very important. Actually, exercise is shown to increase the HDL, the good cholesterol, and decrease the bad cholesterol. And it doesn't have to be anything too aggressive. That just means a 30 minutes fast walk every day. That can help blood pressure, cholesterol, and other things. Other issue that can lead to cardiovascular risk factor are smoking. So tobacco or cigarette smoking can also harden the blood vessel. Smoking also has led to brain aneurysm and other issues. So it's very important to stop smoking. There are certain heart conditions that can cause stroke. So I think everybody needs to know their risk factors and know if they have any heart condition. And again, your doctor, especially your primary care doctor or cardiologist, can tell you about your heart. There's a condition called atrial fibrillation, or AFib. That just means irregular heartbeat. So that's when the upper chamber of the heart doesn't beat as regularly. It can happen at times, once every week, once in a month or so, or it can happen continuously. If AFib is recognized, it's very important to know that there are different blood thinners that can be used to prevent the blood clot from forming, because it's not when it is not beating regularly. There are other heart conditions like valvular disease or other things that can lead to stroke. Diabetes is another major risk factor. When people have diabetes, their blood sugar remains high, and that high blood sugar can lead to hardening of the blood vessel, narrowing, which can lead to stroke, heart disease, a stroke or limb ischemia. So diabetes and other things that can be modified. And obviously there are help and medication that can help with diabetes. Other things are sleep apnea. So when we sleep, sometimes the airway can get obstructed, and that can stress the body, and that can also increase risk of cardiovascular disease. Other thing is lifestyle. I also already mentioned lifestyle, but it is very important to know lifestyle modification is very, very important. What does that mean? Well, everybody should have some exercise plan. Exercise helps with building muscles and also loosening the blood vessels and has a lot of other benefits. Exercise, as I mentioned, can be just a fast walk. So the recommendation is a fast walk where your heart rate goes up a little bit for about 30 minutes. And I would do that every day. It can be treadmill, it can be swimming, it can be different ways. And then part of the lifestyle is also eating healthy. And there are different resources for eating healthy, and avoid excess alcohol and smoking that I mentioned, or any drugs. There are different disease processes that can cause a stroke as well, but those are specific for the patient. For example, some people may have blood clot formation due to some reasons, and those are other things that need to be recognized. Once those are controlled, the risk of stroke and heart disease significantly goes down. But if those are not controlled, they do not. Other thing that's very important is if you have certain risk factors, or if you had a stroke, or then there's some medication that can be used. Blood thinners, there are different blood thinners, cholesterol lowering medication, blood pressure medications, and it's important to know that you're on the right medication. The goal here is to prevent a stroke from happening, because when a stroke happens, although there are treatment available, but stroke can lead to disability. But we can know our risk factors and work hard to try to prevent that from happening. Thank you very much.